Everybody's very concerned about it, and as somebody who's lived it, I just know how easy it is to transmit quickly.
Dr. Kelly Barak has firsthand experience when it comes to COVID-19.
I was at a curling bonspiel early on during the pandemic, and unfortunately was infected with COVID-19. It was very early. The actual day that the bonspiel started was the day that the World Health Organization declared the pandemic. You know, and as healthcare providers, we were paying a lot of attention to the recommendations. We were following the recommendations of the day around size of gatherings and things. But I think we underappreciated at that time how absolutely infectious this is.
Dr. Barak counts himself lucky, saying his symptoms were mild. Months later, however, he continues to struggle with some lasting effects.
Personally, I have issues with energy and fatigue that have been, worse since the infections. As a physician, it's sometimes good to have those personal experiences.
Now, the Associate Dean of Continuing Medical Education is leading the charge in informing the medical community in Alberta.
Physicians and other healthcare providers really need a source of truth to try and stay up to date with the latest developments. So our office has developed a lot of online programming, which we're bringing to Alberta. And one of the things that's very concerning to me, is the fact that it's a younger demographic now that's, really at risk for, seems to be getting a lot of the cases of COVID. And yes, most of younger people will recover. They won't need to be hospitalized, but I think it's important for them to know that there can be long-term side effects to the infection.
As COVID-19 cases rise across the country and we move into the colder fall and winter months, Dr. Barak says this is the time to remain vigilant and to continue to follow safety protocols. Now, he says you should use his own experience as an example.
Although we took precautions like, not shaking hands, wiping down the curling equipment between ends, it was still, I think, indoor gathering, sharing meals, and socializing in the rink after the games, where there was such a high rate of transmission. And so those are still lessons to be learned.
In Calgary, Ali Miller, City News.